What if I told you that cataract surgeries usually don't fail in the operating room, but rather in everyday places, like the living room, the kitchen, or even during sleep? It may sound surprising, but it's absolutely true. While the procedure itself is generally safe and fast, it's what happens afterward that often leads to problems. Many seniors unknowingly make small mistakes during recovery, and those seemingly harmless habits can result in blurred vision that doesn't improve, painful complications, or even infections that put your eyesight at risk. In this video, we'll go over the 5 most common mistakes people make after cataract surgery and walk through exactly how to avoid them. Whether you've already had the procedure or it's coming up soon, understanding what to do and what to avoid could make all the difference in protecting your vision and ensuring a smoother recovery. Mistake number 1: ignoring post-operative instructions. Let's face it, once cataract surgery is over, many people breathe a sigh of relief and assume the hard part is done. But in reality, recovery begins the moment you leave the clinic. It's surprisingly common for seniors to skip their eye drops or miss follow-up appointments simply because they feel okay. But that feeling can be misleading. These aftercare steps aren't just suggestions, they're critical to a successful outcome. Think of them as the final touches after tailoring a suit. Without them, things can unravel fast. Ignoring post-cataract care is a bit like baking a perfect cake and then leaving it uncovered in the sun. The American Academy of Ophthalmology emphasizes that following your post-op routine significantly reduces the risk of complications, including infections and inflammation. So how can you stay on track? Try setting daily alarms to remind yourself about your eye drops, and keep your follow-up appointments written down somewhere you'll see them. If it's hard to keep up, don't hesitate to ask a family member or friend to check in with you. Those small efforts make a big difference in protecting your senior eye health. And believe it or not, even if you're diligent with instructions, what you do physically in the days that follow can still cause unexpected setbacks. Mistake number 2: resuming strenuous activities too soon. Now here's a classic trap many seniors fall into during cataract surgery recovery. They start feeling better, so they assume they're in the clear. The vision's sharper, the eye feels fine, and suddenly they're out there vacuuming the living room, picking up grandkids, or reaching for that box on the top shelf. But let me stop you right there. Just because you're not in pain doesn't mean your eye is fully healed. Think of your eye like a house under renovation. Sure, it might look finished from the outside, but the paint's still drying, the foundation's still settling. Healing after cataract surgery needs a gentle, slow approach. The problem? Lifting heavy objects or bending forward spikes pressure in the eye, and that can mess with the healing process or worse, cause internal damage. So what should you avoid, and for how long? Experts typically recommend laying low for at least 2 weeks. That means no vacuuming, no moving furniture, and definitely no Zumba class. Yes, I've heard that one before. If you need a benchmark, if it makes you grunt or squat, skip it. Instead, use this time to catch up on relaxing activities. Read a good large print book, something inspiring like The Power of Now by Eckhart Tolle, or finally start that audiobook series your neighbor won't stop talking about. Get into light stretching while seated, or take gentle walks around the house to keep your body moving without putting strain on your eyes. This stage of post-cataract care isn't about doing less, it's about doing it smarter. And as you'll see in the next mistake, sometimes it's not just what you do, but what you expose your eyes to that can set your healing back. Mistake number 3: exposing eyes to irritants. After cataract surgery, your eyes are extra sensitive, almost like open doors, and anything in the air can sneak in and cause irritation. Yet many people head outside on a breezy day or dust the house right away without thinking twice. Even cooking spicy meals or being near smoke from grills or fireplaces can cause unexpected discomfort or lead to cataract post-op complications. At this stage, protecting your senior eye health takes more awareness than most people realize. Think of it like driving a car with a brand new windshield straight into a sandstorm without protection. It sounds extreme, but skipping sunglasses or walking into a dusty room can have the same effect on healing eyes. So be proactive. Always wear the sunglasses your doctor provided or opt for wraparound polarized lenses. If you're cleaning or exposed to dust, safety goggles can help, and make sure air vents aren't aimed directly at your face. 4 day-to-day precautions. Avoid going outside during windy times. usually late mornings or afternoons. Use a long-handled watering can for your plants to stay clear of pollen, and skip aerosol sprays or perfumes for the first week. These small changes are easy to make and go a long way in creating a clean, healing-friendly space. And while daytime protection is crucial, there's another risk many people overlook entirely: what happens while you're asleep. Mistake number 4: neglecting eye protection during sleep. It's easy to be careful during the day after cataract surgery, but many people let their guard down at night, and that's when unexpected problems can happen. Your eye is still healing and vulnerable, and while you're asleep, you might rub it, roll onto your side, or press your face into the pillow without realizing. Any of these can slow your recovery or even cause complications that send you back to the doctor. That's why most doctors recommend wearing a rigid eye shield while sleeping for at least a week. It might sound uncomfortable, but today's shields are lightweight, breathable, and simple to secure with a bit of medical tape. Think of it like a seatbelt for your eye. You may not need it, but if something goes wrong, you'll be glad it's there. It's a simple but powerful part of post-cataract care, and one that often gets overlooked. If you're someone who moves a lot at night, try placing soft pillows on either side of your head to help stay on your back, and consider a silk pillowcase to reduce friction around your eye. Keep your drops and shield on your nightstand so they're always within reach. These small steps help your body heal faster, with fewer setbacks. But even with the best habits in place, there's still one more mistake that can make a big difference, especially if it's ignored for too long. Mistake number 5: delaying medical attention for unusual symptoms. This last mistake is one that catches even the most cautious people off guard. After cataract surgery, it's normal to have some blurry vision, mild discomfort, or light sensitivity in the first few days. But if the pain becomes sharp, redness gets worse, or your vision suddenly changes again, it's time to act. The problem is that many seniors brush off these symptoms, thinking they'll go away on their own. That delay can turn a small issue into something far more serious. Nobody wants to seem like they're overreacting, but when it comes to senior vision care, it's always better to make a quick call than wait too long. Conditions like endophthalmitis or retinal detachment can develop fast, and if left untreated, they may lead to permanent vision loss. A simple call to your doctor could protect your eyesight, or at the very least, give you peace of mind. Watch out for symptoms like sudden vision loss, persistent pain, swelling, flashes of light, or a shadow in your field of vision. These aren't part of normal healing, they're warning signs. Keep a list of them somewhere visible, like your fridge or mirror, and make sure your eye doctor's number is saved in your phone under Eye Emergency, so it's easy to find when you need it. Even smaller issues like dry eyes or floaters can be worth checking out. Sometimes it's just a minor tweak to your post-cataract care plan, but other times, catching something early can prevent major complications. If you wouldn't ignore smoke coming from your car, don't ignore unusual signals from your eyes. You've already taken steps to restore your vision. Now it's about protecting that investment every day. Avoiding cataract surgery risks isn't only about what you do, it's also about paying attention to what doesn't feel right. If something seems off, trust that instinct and take action. And all of these lessons lead to something even deeper. A shift in how you think about recovery, your health, and the simple choices that shape long-term results. So now that you know the 5 most common mistakes, and how to avoid them, what will you do differently starting today? Will you finally set that reminder for your eye drops? Or maybe take that extra step to wear your sleep shield tonight? Small habits lead to big results, especially when it comes to cataract surgery recovery. And let me ask you, have you made any of these mistakes before? Or do you have a tip that helped you during your own healing after cataract surgery? I'd love to hear about it in the comments. Your story might be exactly what someone else needs to read today. If this video brought you clarity, no pun intended, go ahead and give it a thumbs up. Share it with a friend or loved one who's going through the same journey. And of course, don't forget to subscribe and hit that little bell so you never miss a chance to learn more about senior eye health, post-cataract care, and smart tips for thriving well into your golden years. Tap the next video on your screen right now to keep learning how to protect your health, your vision, and your quality of life. You've got this, and I'll be right here with you every step of the way.